Go live with. Here we go.
Hello.
You are?
Hello. Can you hear me?
We made it. Good. Everything okay?
Yeah. Can you hear me all right?
Yes.
Yeah.
Perfect.
Oh, well, I couldn't find anything to prop my. I've left my. Oh, it's been a nightmare. But anyway, I'm here
Good.
holding this up with my hand. I've got my new little mic as well. I've
Hopefully
invested.
you can hear me okay, because I forgot about
Yeah,
using a mic.
yeah, no, I can.
Okay.
First time anyway, sorry about that.
So, all calm. So maybe we should tell people how we know each other.
Yeah.
So yeah, we met doing the Molinari Women's Health postgraduate diploma, which was life-changing maybe for both of us.
Yeah.
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 Right. Yeah, fantastic. So we've both been specialising in women's health osteopathy before and after that, I think. But yeah, why don't you share a bit about your background, Gayle, and what you...
Okay. So I came into osteopathy a bit later in life, like actually quite a lot of people train later as an osteopath. So my background was in beauty, complementary therapies, massage, bodywork. And I trained in that when I was sort of 16, 17, 18, and then worked in spas, and then sort of quickly became a body therapist. Then went into teaching, and I taught actually in post-compulsory education for about 20 odd years, and mainly sort of bodywork. I did quite a lot of the more advanced stuff, so worked quite a lot with machines, so like body vacuum suction, things like that. And then I decided, and all that time, because this is why I'm getting to this, in all that time, most of the people that I worked with were women, girls and women, and I'd hear lots of the issues that they have themselves. Obviously I'm a tutor, I'm a like pastoral advisor to these people, or a trainer, and that they'd be living their lives along with what they're doing with me, and there was just so much, and so much sort of swept under the carpet, and they had so many issues that were like fighting to get seen or by the doctors or the specialists that they needed to. And everyone had something going on. And then I had issues myself. I fell pregnant when I was 24, and in that time in my pregnancy I had pelvic girdle pain, which was just debilitating. I also had preeclampsia. I unfortunately lost my daughter. She was born at 4 days old, and because of I had a placental abruption, she passed away. So I had lots of my own stuff as well. Had C-sections, I had 2 children after that, C-sections with each of them, had issues breastfeeding, just no support. So all this culminated into my, like, I need to do something to help other people. So that sort of led me to us. And then I also wanted to do something a little bit more than what I was doing, because I'm always trying to do more. I'm always like retraining, doing something. And that sort of led me to osteopathy. And then I found I could combine both things, and I was like, wow,
perfect.
Yeah,
Brilliant. The clinic specialises in women's health.
Yeah, so we specialise in women's health. We we also treat babies, quite a lot of babies, and I am an infant feeding coach, a breastfeeding coach. So I help not only with the babies, I help with the feeding, and then postnatal rehab and recovery, really. So it's like and then obviously we do all the other stuff, women's health as well, sort of post menopause, perimenopause support. We also have a counsellor as well that works with a lot of our patients. So we're trying to do, a bit very
the whole holistic picture.
Yeah, which is what osteopathy is, isn't it? Really, I mean, the times I have women come into me and they sort of tell me everything, and then they're like, "Oh, I feel like I'm having counselling as well." I'm like, "Well, mind and body."
Yeah, exactly. Yeah. So lots of cross referrals over to the counsellor and things like that.
Yeah. We also have a complementary therapist who specialises in perimenopause support and uses aromatherapy to help with hormone balance. And so there's lots of cross referral, and from the wider community as well. There's a lot of referral in from sort of midwives and other
Yeah,
practitioners.
great.
I'm sorry, I'm a bit unstable because I haven't got anything. Sorry.
So tell me a few sort of typical physical challenges you might see in the sort of postnatal women who come to see you.
Um, so yeah, sometimes it's sort of just breathe. Wow, the main thing is breathing, and I think you speak about this quite a lot, don't you?
Yeah,
Oh, if you haven't got the breath right, it's not going to happen.
yeah,
So they just don't breathe properly, and obviously postnatally they all come in with a sort of a retained pregnancy posture, so increased extension through the back, lower back, and then they rounded shoulders from their feeding, and they've got this forward head carriage, and
yeah,
then breathing properly, and then that means then their pelvic floor isn't working properly.
yeah.
So that is the first thing. That's everyone that I see, I have to sort of retrain their breathing.
Yeah.
So that's the main thing. And then obviously after that, it's then having a look at what's going on with their pelvic floor. And a lot of them think that they, just, oh yeah, I've been doing my pelvic floor exercises. And so one of the things that I notice is, because obviously when we do assessment, we do an internal assessment to check the pelvic floor, and they're not contracting their pelvic floor, they're just squeezing their bum cheeks together, and they don't understand. And then we have the other side that have been doing it, and actually they're hypertonic, so everything's just too tense. So it's really, and then also it's like I say, I don't know whether you get this as well, but do you have any urinary issues, any leakage, any issues with urination post birth? No, none at all. So I've now started saying, if I had a trampoline in here and asked you to bounce on it, would that be a problem? And they go, oh yeah.
That's a great question. I'm going to steal that.
Yeah, because they just weren't. They go, no, I don't have any problems at all. And like, you do.
Yeah.
You just don't realise, because we've been trained to think that it's normal, and it's not.
Yeah, exactly. We've all been brainwashed that it's oh, you had a baby, what do you expect?
Yeah. Do you get the same sort of?
Oh yeah, I ask people, sort of they might come to see me for something else, and when you ask them, they're like, oh no, oh, it's all fine. And then they might, as you're treating, they might go, oh well, actually I do lick a bit, but doesn't everyone?
Yeah. And then they don't actually also realise that the bowel issues are linked either, because then we start talking about that and they're like, oh yeah, well I have got some problems here, and then we sort of, I don't know, I think I need to make my my consultation time longer, because it's getting, you really have to spend time pricing it out.
Yeah,
They don't actually understand or realise that they've got these issues, that actually we could work on all of that. They think they have to just put up with it.
it's accepted that that's what you have to deal with after you've and as you get older, and no, don't accept it.
Yeah, absolutely.
Yeah. So what do people normally come to you for? What's the reason they might come in the first place?
So the clinic's sort of still in its sort of infancy. We've been Align Osteopathy for 5 years, and we've been in our clinic for 3, and we are starting to get sort of our name out there, especially with the baby stuff. So we get lots of babies. So what I do try and do is sort of educate the mums to, you need some support too. So there's that. So postnatal, yeah, I do the mummy MOT, which is more of like an assessment and a program really, and then we identify what needs to be worked on. And then I also get we have a pelvic health appointment as well, which some people come in that way. With the pelvic health appointment, there's treatment, so we sort of push people to where they need. So some people just want to come in and get back to exercise, and so that's fine. I do that with them. We do exercise programs and rehab. But then for the pelvic health, we have, there's osteopathic treatment in with that.
Yeah.
So yeah, and that's what I'm getting quite a lot of. And then the other people that come in for like back pain or hip pain or knee pain, to be honest, when we look at everything, they also need some pelvic treatment. So when we look at it, it's like, oh, okay, this is because this is happening, and your pelvis isn't stable because you're not, obviously, perimenopausal, menopausal, postmenopausal women, they're losing that muscle mass every year. and they're not doing anything about it. So this is what they don't quite understand. Actually, you know, we need to make sure that we're keeping ourselves strong, and that it's all about education. So everybody that comes to me has their pelvis worked on, whether they want to or not. Really, no, that's really. I do ask them, but yeah, they don't realise it. I think that's the key. It's
Yeah.
like, I don't know. Is it a cornerstone? What do you call it? The cornerstone? Is it that what you call it? Like the main
Middle of your body, isn't
yeah,
it?
it's the yeah.
Yeah. Your core's not going to function if your pelvic floor's
No,
not. Yeah.
no.
So yeah. So what do you give them sort of simple advice of things they can do at home? Is there a sort of common thread other than breathing?
Yeah, so what we do is the breathing, and then depending on what's happening, because it depends on whether there's hypertonicity there or not. If there's hypertonicity, I talk to them about how they can release that, so the relaxation. We also I talk to them about self-release and using things like a pelvic wand or dilators. And I've actually got a little model now that I do I can show them in clinic. I've got something to show them how to do it, because people are like, oh yeah, use a pelvic wand, and no one really understands what that is or what to do or what it looks like. So
It's not
I've
the
got
kind of bring out at brunch, is it?
no.
Like...
I do warn my patients. I'm like, right, no judgment, but I really need to sort of show you. So I bring out a little demo doll that I got from Love Honey. But they're always amazed. They're like, oh, where did you get that from? That was really informative. And I'm like, actually, I ordered it from Love Honey. But it's really it's worth it, because I've shown lots of stuff on there, and how to, you know, if they're having issues with constipation, how to sort of splint, and you know what they should be doing. Anyway,
is that if it's rectocele or something?
Yeah. I've also got. I love the toys. And I need to send you it. Actually, I made a crocheted vagina with a rectocele. So I get that out and show the anatomy, and people understand. So that's what I do with tension, and then with the rehabilitation. So when I have pelvic rehabilitation for postnatal, who don't tend to have, it's not necessarily weakness of the muscle, if they haven't lost muscle mass, it's just function, so just connection. So we make sure we activate sort of the muscles around the hips, you know, the glutes, get them working with the pelvic floor. And then sort of the perimenopausal women that are losing the muscle mass, we do that sort of similar as well, but obviously less the exercises that they can cope with, which are usually a little bit than a completely really new postnatal.
And it's important to not overload them, isn't it, to try and make sure it's something they can fit into their life.
Functionality is really important, and making the exercises functional and fitting it into their life, really. I know, do you do the same?
I really try to sort of talk about sort of stacking the habits into other things they're doing. So, you know, practicing balance things when they're brushing their teeth, doing a few squats when they're waiting for the kettle, things like that, you know.
Wash that washing machine.
Yeah, exactly. Don't waste time, basically. You know, there's no day. So just, you know, any kind of time where, you know, if you need to be relaxing, then relax. That's important as well. But if you're doing something, scrolling, you know, that's not adding anything into your life. So may as well do something productive for your body.
Absolutely.
So trying to find time. Everyone's got time, but just need to find it. Hiding.
Yeah, and I think they don't realise, you know, the amount of times I've said to people about fitting these things in with their daily life, they're like, oh yeah, they don't actually think about the muscles that they need to do those activities and how to make that an exercise in itself, which actually I think, especially the people that we see, busy mums or people working, or they need that. It's tiring. Everyone's tired the day and doesn't feel like they want to
trying to do too much in one go, just going, right, today I'm going to focus on this exercise, or and just building it in until once that's a habit, you won't have to think about it and you can add another one in. That's how I always approach it, really. And do you find that the sort of emotional health of new mums might sometimes has an effect on their physical body?
a huge amount. What I found is the sort of the get connecting. I say, you might laugh, but I always get them to reconnect with their vagina, because I'm like, you need to reconnect with, that's part of your body. You should love it, whether the babies come out of there or not. You need to reconnect with it, because we ask the question, have you had intercourse, is there any pain with intercourse? And a lot of them are, no, I was waiting for you to check, or you get, yeah, there is pain. And actually, so we do the internal assessment. I'm like, okay, is this where the pain is? Yeah, that's exactly it. Right, now just relax.
Yeah.
And then they go, oh yeah, the pain's gone.
Yeah.
Okay. It's all about that tension, the stress related to it, the worry about, is it the same down there? Probably not going to be the same, because you've had a baby.
Yeah.
But it's not as bad as you think it is.
That's, touching your own vagina or your C-section scar is so powerful, isn't it?
Yeah.
Sort of brain sort of reintegrate it. And
yeah, the C-section. Sorry, say that again.
I just said to make the tells your brain that it's safe and it's okay.
Yeah, the C-section is actually really interesting, because I've had a few patients lately that when we explore the C-section, so we touch the C-section and I examine it and feel around, and it's not painful, but they cry because there's so much emotion connected to it. And then they're like, oh, I don't know why I'm crying. I'm like, well, you're not the first. And I've actually run out of tissue. That's reminded me I need to get a box of tissues, because it's such an emotional thing, just reconnecting with your body. It's whether you view it as traumatic or not. As I said, I've had C-sections. I don't view them, my first one was, but the others, I didn't view them as being traumatic, but there's still huge emotion.
Exactly. So it might not be the physicality of it might not be the trauma, but the emotional reasoning behind why you might have had the C-section, what happened before having it, all of that stuff plays into it, because giving birth is such a huge emotional thing, isn't it?
Yeah.
And maybe she was desperate to have this natural birth, and she tried and tried and tried and tried. She's exhausted, and it ended up being a C-section, and she just blames herself, etc., etc. Yeah.
That's a really good point. And actually, I can't remember, it might have been Cher on one of our courses that talked about that lady that wouldn't say she gave birth because she had a C-section. And I was exactly the same. Until that point, I never said I've given birth. It was I had a C-section, and I never saw my giving birth.
You felt your body had cheated or something.
Yeah. And that sort of unlocked a little like a moment, because my body didn't do what it was supposed to do, even though my second two were they were elective. I planned for them because of everything that happened. I was like, no, I just want to just do this. So I planned it, and they were my second C-section was a really lovely experience. My youngest wasn't so much. They weren't as good with the second. It was fine, it just wasn't as nice an experience. But yeah, in my view, I'd never given birth. Yeah. Which is weird, isn't it?
Yeah. But again, it's that sort of conditioning that you think, or you haven't earned your stripes or something because you haven't, bollocks.
Yeah, it is. Absolutely, isn't it? I'm like, when you unpick the thoughts around things, and there is so much, the
same sort of thing, breastfeeding and bottle feeding. There's that stigma attached, isn't there? That I can't breastfeed. Oh no, what's wrong with me?
Yeah.
See, that's a lot in your clinic.
Oh yeah, a huge amount. And I talked to my mums or parents about breastfeeding grief, about not feeling like that feeling of, even when they've breastfed for like years, and they're like, there's still grief around it, and sort of feeling around breastfeeding. But I'm always seeing the whole, oh, I can't do it, and and feeling like a failure, and it just there's so much pressure on parents. It just is. It is heartbreaking sometimes, the pressure that they actually put themselves under as well. And I don't actually think that, that we're on social media now, so it does do some good things, but I don't think, this whole like Instagram bouncing back,
Yeah. It's always seeing sort of skinny women jumping around with their babies doing Pilates with the baby as a
Yeah.
weight, and great. That's some people, that's fine, but the majority of women, no, they'd rather be in the tracksuit watching Netflix with the
Yeah.
baby and relaxing.
But then you also get the some of the older generation then telling them that we should be putting your baby down. You should stop spoiling them by picking them up all the time.
Yeah,
They've got it from all angles,
yeah,
really. They've got people saying, well, you need to put your baby down. Then others saying, well, you must never put your baby down. Don't let them cry for a second. It's like,
yeah.
oh, what would oh.
That, yeah. It's sort of second guessing their own judgment.
Yeah.
Yeah, yeah, yeah. It's hard. Being a new mum is hard.
Really, really
Yeah.
hard. And I just, my whole, whilst I love working with all women at all ages, I just love it. But the mums, the new postnatal mums that are really struggling, because it is, you hurt, you're tired, you've got all the feelings about the birth and your body changing. It's such a vulnerable time.
Yeah, no, it must be a really rewarding niche, group of people to be working with. I love
It is, and there isn't enough support for them out there, because there is support, and I don't know, there is a little bit of me that feels like there's lots of support, and for when you're carrying the baby. Once you've had the baby, it's all about the baby.
Yeah.
Their mums are just like, oh, you're all right, just get on with it.
Yeah, like the standard 6-week check. I often see women, and all they've had is they're checking the baby, and then there's a brief kind of, oh, are you okay? Making sure they haven't got depression, and that's it.
And I asked a GP about this, because I see that too, and they come to me and say, oh, I went to my 6-week check and I didn't get anything. And I asked them, and there's a reason for it, and I'm not blaming GPs at all, because I think they do a great job. But I said, why are the women not looked at all or checked? And they said, because the funding is for the baby, it's not for them.
Yeah.
6-week check, they check the mum. Obviously, if there's something going on, they'll, of course they will. But the funding and the time isn't for the mum.
Yeah.
And that's nuts.
Yeah. 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 So that's where we come in.
Yes. Yeah. I just, I wish that we could do more. And it's obviously, at the end of the day, we are a private service. We're a private service,
Yeah.
so you obviously have to pay for it. So we're missing out a lot of women that perhaps can't afford our services at the moment, which is really, really sad. But
at least you can educate.
Yeah.
You can send, put
education, and also what I'm trying to let people sort of, so I chat to patients first before they they book in, if they want to, so they can book in a free sort of chat with me. And what I like try and tell people is that yes, it isn't cheap, to come and see anyone privately. You have to pay for it, but the what you get out of it is actually really worth it, because in one session, if you just did one session, you could get so much information and support.
Absolutely.
Really is worth it.
Twice your haircut.
Yeah, I know. Your Botox and get your nails done. I mean, that's great. Self-care is fab, but at the same time, look at the stuff inside, and if you can sort of not pay for, I don't know, your lashes, or I'm not saying all mums do this, so they don't, but this might be something that you can put off for a little bit, to just have one session, just to make sure everything's fine and get some advice. It really does pay, and it could stop you when you're an older lady, going into a care home because you can't control your bladder.
Yeah, isn't that that's one of the major reasons that women end up going in?
Yeah. Yeah. We don't think about that, and no one really talks about that either.
No, exactly. It's slightly depressing that for people who don't know, and then it's got to get to the point where,
if you'd have done something a little bit earlier with a bit of education and just a bit,
Well, we're here to spread the word, aren't we?
Absolutely.
So what's one message that you wish every postnatal woman knew about their body?
Oh, okay.
Put you on the spot here.
Okay. So I'm just trying to how I word it. Give yourself a break.
Yeah.
You shouldn't be bouncing back straight away. It takes at least a year for your body to recover. The first 6 weeks, all you should be doing is a bit of walking, some perhaps gentle stretching, and breathing properly. That's, you know, and then take your time. There is no bouncing back.
Yeah. Perfect. Thanks, Gail.
So, thank you.
Where they can find out more about you and Align Osteopathy.
Say that again. I missed.
Where they can find out more.
So you can, I don't know whether I'm sort of, I don't know how this works. It's the first one of these done on Instagram. I don't know whether it tags me or anything.
I think you're on,
so,
you're on there as a joint host, so people could follow.
So follow me. So I'm on Instagram, Align Osteopathy, and I have Facebook page, again, Align Osteopathy. We're in Totton in Southampton, just on the edge of the New Forest. And you can follow us on social media. We have our website, www.align-osteopathy.co.uk. But yeah, I'm on social media quite a bit, and Messenger, so you can contact me through all of those things, even if it's for a question. You know, I really don't mind. I'm quite open. I'm also on the 28th of February, I will be at Eastleigh Places Leisure for their mum and baby event, and I'm going to be doing a talk there on precisely what we've been talking about now.
Brilliant.
Pelvic health. So I'll be doing that there. It's a nice little event. If you're anywhere near that area, sort of Eastleigh, Chelmsford in Hampshire, Southampton, come along and see us.
Brilliant. Thanks so much, Gail.
Thank you for inviting me. I'm sorry it was all a bit, you know.
No, I hope you get it also.
All you can see is my face. Yeah. Right then. Have a lovely day.
Thank you. Bye.
Bye.